All right. Welcome, everyone, to this Oregon State Board of Nursing Lunch and Learn event regarding Oregon Administrative Rules, Chapter 851, Division 41 of the Nurse Practice Act. This division pertains to the standards for the nurse intern licensure and functions. So my name is Laura Blackhurst, Policy Analyst for Nursing Education, and I am joined by guests Cindy Neubauer and Jessica Gross from Sky Lakes Medical Center in Klamath Falls. On the call are several other board staff, including Nicole Van Winkle, Policy Coordinator, who is assisting me in monitoring the chat, as well as our Executive Director, Rachel Prusak. This session is being recorded and will be uploaded to the OSBN YouTube channel, Oregon State Board of Nursing, that's all one word, for viewing at any time. Otherwise, if I can ask that you please mute your microphone and hold off on questions until our dedicated time for questions and answers. As questions come up, you are welcome to put them in the chat. I just ask that you please refrain from using the chat for any side conversations. And then additionally, Nicole will be placing a web link to the Division 41 rules in the chat for anyone who wishes to review the rules during the presentation. So today's content will provide an overview of the Division 41 administrative rules, including information regarding rule revisions that became effective March 1st. Our plan is to provide a brief overview of all administrative rules related to the nurse intern. Following this presentation of administrative rules, I will hand my microphone over to the team at Sky Lakes, who we will hear from on how they've successfully implemented the nurse intern role at their hospital and have developed a nurse intern program. And then at the conclusion of that content, we will have time for our questions and answers. And again, please place any questions in the chat. If you are asking about a rule, please include which rule number your question is referring to. So I will begin with a brief description of Division 41. So broadly speaking, this set of rules is where the 9-member governor-appointed Board of Nursing operationalizes the NPA's statutory requirements related to the licensure and functions of nurse interns. The standards in Division 41 clarify statutory requirements to ensure that only applicants who meet specified standards receive a nurse intern license, as well as clarifying how the intern functions as a member of the healthcare team and their professional responsibilities related to conduct and reporting. This license type was first established in 2022 following the passage of House Bill 4003. The nurse intern license and role was designed for nursing students to be able to extend their learning, gain valuable healthcare experience, while also benefiting from paid employment during the course of their nursing program. And although we will be reviewing all of the nurse intern related administrative rules, in identifying the biggest changes to Division 41 over the last few months, these changes would be simplifying the requirements for the nurse intern license, simplifying the license renewal process, clarifying the obligation of the intern's duty to report, and clarifying the authorized functions and prohibited acts of the nurse intern. So with this, I will move into the brief overview of our Division 41 administrative rules. So Division 41 begins with Rule 0 or 0000, which identifies the purposes of standards. This simple rule provides an outline or overview of the rules that will follow in Division 41. And again, highlighting that the purpose of these standards pertains to the intern education, licensure, and role. The next rule is 0010 or Rule 10, education standards for nurse interns. The Rule 10 establishes the standards of the pre-licensure nursing education program that an interested applicant would need to attend in order to qualify for the nurse intern role. Currently, all Oregon nursing programs do provide the qualifying education. This rule also establishes standards for nursing programs providing academic credit to the nurse intern for their experience. It's important to note that the decision to award academic credit is a decision of the nursing program, and a significant consideration for the program is whether there are learning objectives, faculty involvement, and evaluation of learning related to the nurse intern experience. Rule 0020 or 20, requirements for the nurse intern license, is next. As you might imagine, this rule describes the requirements for licensure. In Rule 20, it identifies that intern applicants must have completed one academic term in a nursing program, have completed one academic term in a course with a direct care clinical component, submit verification of good academic standing, complete a criminal background check, and pass the certified nursing assistant exam. To aid in this process, the nursing program provides to our licensing staff the verification that an intern applicant has indeed completed the required academic coursework, attesting that they are a current non-graduated student. Recent revisions to this rule include updating the academic requirements from a requirement of 1 year in a nursing program to 1 term in a nursing program, as well as removing the limitation on the number of attempts to pass the CNA exam by specifically removing rule language that limited applicants to 1 attempt per term. Importantly, these changes will allow more nursing students to pursue the nurse intern license earlier in their programs. These changes especially benefit students in programs that may not have much academic coursework beyond the first year. Next is Rule 0030 or 30, the renewal of nurse intern license. Again, broadly, Rule 30 describes the renewal process. A significant revision to Rule 0030 is the length of the nurse intern license once issued. By extending the length of the nurse intern license, that impacted the timeline for license renewal. So as noted on the screen, the length of the nurse intern license was previously a license that expired 30 days after the end of an academic term. Following our recent rule revisions, the nurse intern license is now valid for up to 12 months, with licenses now issued for a period of September 1 to August 31. This means that whether the applicant applied for an intern license in September or they applied for that license today, that intern license will expire on August 31st. A renewal would become effective September 1st, and that license would be active through August 31st of the next year. The board and board staff have identified that these revisions will reduce barriers for applicants who might otherwise have needed to renew their intern license multiple times in a single year. This rule revision also reduces the burden on nursing education programs needing to continually re-verify for the board the student status. An additional benefit of this rule revision is that now the nurse intern license will not expire over academic breaks. For example, summer breaks when nursing students might be most inclined to seek out a nurse intern role. It will move us to Rule 0040, Nurse Intern Healthcare Team Member Role. Rule 0040 describes the nurse intern's role as a member of the healthcare team. Within this administrative rule is information describing that the nurse intern must function under the direct supervision of an RN, and that their role is limited to the performance of their authorized functions. Rule 0070 is conduct unbecoming a nurse intern. And as the title suggests, this rule outlines the conduct that is unbecoming a nurse intern. Further details of this conduct unbecoming are provided in the rule. Rule 0080 outlines duty to report. And in the duty to report rule, there are standards for reporting requirements pursuant to ORS 678-135. Recent revisions to this rule have added requirements that nurse interns must report any leaves of absence from their nursing education program, as well as report any failure to maintain good academic standing. Finally, I want to highlight two rule repeals. These are rules 0050 and 0060, which previously established nurse intern authorized functions and prohibited acts. The repeal of rules 0050 and 0060 became effective on March 1st. The nurse intern authorized functions and prohibited acts are already outlined in ORS 678-396. Previously, our administrative rules contained language which mirrored our statutes, but imposed additional limitations on the nurse intern functions. Because of discrepancies in interpretation, the rule language has been removed for clarity because these functions are so clearly expressed in statute. Otherwise, that concludes the brief overview of our Oregon administrative rules related to the nurse intern. And so, having covered that, I am very excited to hand it over to Cindy and Jessica at Sky Lakes to hear about their nurse intern program.
Thank you for having us. We'll get right into it. So we started the nurse intern program back in July of 2023. Basically right after it got approved, we were able to get this established, and Cindy will talk about that process a little bit.
So we were very, very fortunate is that both our Chief Nursing Officer and Chief Operating Officer, Ron Wada, was very, very interested in this program and really had the vision that this was really a win for both the student and for the organization. Then we have a new Chief Human Resources Officer, Brian Fix, who had actually seen this work successfully in other states. And those two men became our champions that really, we got that executive support. So we were really able to move forward with it. From there, once we were given the okay to go ahead, the nursing leadership at Sky Lakes was really excited. They really saw the ability of a program like this to assist our staff and it being that extra pair of hands when that's really needed. And honestly, the frontline staff was a little bit less, they weren't quite sure, but now any one of them would say that it's been the best thing that we have ever done. And so we did that stakeholder analysis and worked for the buy-in. And then before we even started, we started looking at how are we going to get feedback from people, having a structured approach to make sure that everything we did was meeting the expectations of our stakeholders. In addition, Jessica worked out a program that is very similar to our nurse residency in regular checkups with these individuals to assess their progress, gather insight, and provide that overall support for them as they are in this learning process. And then agreements made on which nurses would have a nurse intern. Next slide. This also was very, very important because, of course, these are students that we partner with our local schools to introduce the idea to them and to make sure that we had their support as well. We are very careful to respect the nursing school schedules to ensure that if they're having finals that we're not asking them to work, and we're pretty flexible with them as far as we know that it is very important that they do well in their program and that they graduate, and we hope to keep them. So working with the schools has been clearly successful for us. We also, as far as promoting those intern opportunities, the schools have been great about letting us come talk to their students. But one of the big concerns was that somehow the school was responsible for the students' knowledge base and that they had to have checked them off on the skills. We developed a very robust process to ensure we put them through our own skills lab with our own equipment and supplies and check them off on all of the skills that we expect that they are doing. And that is also shared with our nursing staff. From the student perspective, I honestly believe that this is the best thing for any student. It gives them a lot of time to really absorb what I call the nursing brain, as far as being able to think like a nurse when they are in the clinical setting and they're watching that happen. Those extra hours are invaluable for them. Next slide. Is this you?
Yep.
Mhm.
So what we wanted to do is make sure that we had a lot of oversight. This was something very new to our organization, and having in time feedback allowed us to then zig and zag as we needed to make sure that we were meeting all the expectations within our nursing staff, but then also with our patient population and making sure that they were getting the care that they need. So I did regular check-ins. I'm a hoverer. I am a helicopter mom by nature, so I'm always on the units, checking in with not only the nurse residents, but also our nurse interns. I'm talking to the nurses that they're working with. I'm talking to our management team and the CNAs that they work with as well, because that's how we built the team, is that they are kind of that middle man between CNA and the nursing staff. So I check in. This is how I individualize their education and how we proceed with them moving to higher acuity. And we'll talk about that in just a sec, but this is how I evaluate based on the individual and how they progress. I take what I get in feedback and then I implement, whether it be further education or maybe an individual is struggling with IV insertion, then I have them go to day surgery or work with IV therapy to kind of build those skills out a little bit more. So constant feedback, constant making sure that everybody is right where they need to be with their hire date. So we'll go to the next slide if you don't mind. So patient care protocols, we have a really robust, and you'll see it in the next couple slides, expectations, and we lay that out in the very beginning. What we want is this position to be able to give safe and effective care to our patients, whether it be medication documentation, or infection control guidelines. So what we do is we go over these policies and procedures with them so they understand what they're walking into on day one. And then we work on I built a whole professionalism course that they go through to, even be able to be effectively communicating with patients and know what the expectations are in a professional setting such as Sky Lakes. We remind them that this is always kind of a working interview and that teamwork and collaboration is so important because we would like to see all of our nurse interns as new grads at some point. So we really do our due diligence in the beginning at hire time to make sure that they know what that nurse intern role means to our organization. So next slide, please. And this just goes further into making sure that our patients are always in our mind with safe patient care, compassion, and is as our priority. So we want to make sure our patients are getting what we think that they should have when they're staying with us at Sky Lakes.
I just saw a question in the chat, and just to put it right here this is a paid position.
Yes.
This is a paid position, and it is, I believe, supplemental. We go with supplemental.
It's temporary.
It's temporary, which allows us to give them during times where they're taking finals. They don't have to work for that period of time. So we really try and be really flexible with them to ensure that they continue to do well in school as well. So
All right, next slide, please. So the way that we start out each nurse intern when they are hired is they go through our orientation. That is when we go through all of our skills training. We get them up to our standards with policies and procedures and just regulatory training. And then we start them out with orienting with the CNA. A lot of nurse interns have never worked in patient care settings, so we make sure that they have the fundamentals to be able to take care of patients properly. Body mechanics, we work with how to move a patient, you know, even to communicate with the patient, those things that they might feel that they struggle at first. So they orient with the CNA, and it's all individual based on how they're developing. I work with the CNAs, check off how they're doing. If they're doing well, then we'll move them into that nurse intern role. And where they'll be working with under a nurse completely, and it's one-on-one with a nurse at all times. Their patients are the nurse interns' patients. As we grow and develop, we look at how they're doing. They start on med surg. Can they be progressed to a higher acuity level of care, like PCU, ICU, med surg, FEC, which I do have nurse interns working in all of those areas right now, and with the flex team as well. So they get a good eye-opening experience of all the different areas within our organization as they're in their student nurse intern capacity. I really work with the nursing staff, the nurses that work directly with nurse interns, the management, to really make sure that we're making these transitions at the right time, because what we don't want is the student or the nurse intern to feel fear as they're trying to grow and develop and learn, just to be able to make sure that they are comfortable with the move as well. So those check-ins are usually daily, if not every other day. I do my due diligence in that. And I make sure as we go along, the expectations are streamed through everything. We want to make sure we're providing safe patient care, so we really emphasize those. All right, next slide. This is what we provide to our nurse interns so they understand the expectation. We really want them to meet Sky Lake's mission and values, so we include that with the expectation on top of being present, showing up on time, participation. We do have little seminars from time to time to make sure that they're up on all the latest skills and information. So we set that tone in the very beginning. And this is something that we do with all of our programs, nurse intern and any other programs we have at Sky Lakes.
I did want to speak to our expectations a little bit more. If you'd want to go back one slide. Is that one of the things that we found is a lot of times our assumptions were that people would know some basic things, but along with teaching the professionalism, having really going through this document with them and walking through what our expectations are, and like Jessica said, we do it with all of our programs, has been really life-changing. We're not dealing with as many, you know, oopsies along the way. We kind of put them all out front. Thank you. Next slide.
So some of the lessons we learned, and they weren't unfamiliar to us going into this, is we knew that we were going to build nursing students in this role. They were going to get the hands-on experience. We knew that they were going to get the time in and really be able to build. We wanted to just make clear, like, building these skills will focus on developing key skills earlier on in their career, so they'll get the training for body mechanics, stress management, how to deal and cope and be resilient to burnout. So we really honed in on that as they get hired and throughout their time with us at Sky Lakes as a nurse intern. We really we want to provide a supportive team. So the nursing staff have been great with them in educating them. The management will make sure their doors are open to them, and then all of training and development will go by and just see how they're doing on a day-to-day basis. So we really want to foster that team build and be able to build resiliency earlier on in their career. We feel like this would lead to the longevity of their careers with Sky Lakes, and so building that team earlier on will help hopefully build a team for a long time. Some oversight that we've seen is we're starting to see our staff maybe unfairly judging the non-nurse intern students, and assuming that they're equal because they feel like they're in the same cohort at school, that they should be all at the same capacity, not realizing that our team has really built and developed these nurse interns with the clinical thinking skills and just being able to do the day-to-day operation. Have anything to add to that?
No, it's wonderful picture.
I love those guys. So those are actually some of our nurse interns that are still, some of them are still working with us, all but one, but they're a great group.
And of the ones that you see there, they will become our nurse residents when we get to July, when our new grad program starts. So it works well for recruitment as well.
Yes. We can move on to the next slide if you don't mind. All right, so what we've received in feedback from our organization as our nurse leaders, they were very helpful in being able to provide the nurse interns in short staffing during December with, you know, high influx of patients, and our nursing staff was sick or on vacation. Nurse interns really stepped up and was that extra set of hands, and I think the whole organization felt supported in that, and I think the nurse interns felt good that they were able to come in a time of need and provide patient care, so our patients didn't suffer in that time. I think the biggest feedback I hear is I wish this was around when I was in nursing school, and I can't help but to agree with that. I would have loved this opportunity, so it comes from a good place, I believe. And then seeing the difference in in their classmates who are not nurse interns, I think they're feeling it as well as nurse interns, that they can see that they are growing and developing from their classmates that they're in school with. Staff appreciate the help. CNAs love having an extra set of hands to help with vitals and getting patients up to the bathroom. It's been tremendous in their workload and helping their burnout as well, and the nursing staff. And then our frontline staff is similar to the nurse leaders. They love having it, wished it was around when they were in school. And sometimes we actually have little bicker fights of who's going to get the nurse intern from that day, especially if they weren't directly assigned to someone, which is always fun. It's kind of nice to be the nurse intern and being like pulled in two different directions, but it all works out in the end. They help out everybody who's on the floor, so it's a good position to have when you have a nurse intern on your unit. So next slide, please. So some of the other feedback that we got directly from nurse interns is that they are extremely thankful for the confidence they have gained, the competence and skills and their ability, and just knowing that they can do the job. I think that's huge. Their patients' interactions are so much better. You know, they first come in and they're unable to even ask like basic questions, where they come in and they can joke and they feel more comfortable with the patients that they're taking care of. So that just builds that confidence level. And having a better understanding of policies and procedures. As students, they don't get to see all the policies and procedures when they're in their practicum. So this is a good ability for them to understand that for when they get into their practicum, they already know kind of what to expect and what to look for and how to look for those things. And then they build relationships with the nursing team. You know, they hope to work with us at someday, and they've already built that relationship. So when they jump in as that independent nurse, hopefully they feel comfortable with the teams that they're working with. And we, in the 3 pictured, have been B award nominations. If you're not familiar with that, it's our internal award system for people who go above and beyond, that patients have nominated them for an award because they provided special care, and all 3 of these nurse interns were nominated for that award, which is pretty special to me. And when we were able to present it, they were over the moon with that nomination. It's kind of a neat little thing that we do here at our hospital. It's similar to the Daisy Award, if you're familiar with that. And that's all we have for you. So thank you for having us and letting us present.
Well, thank you, Cindy and Jessica, so much. We really appreciate your time and just talking everyone through the program that you've developed, because this nurse intern license and role is still so new in Oregon. So with that, we'll move into our questions and answers. And That will be facilitated by Director Prusak.
Thank you. Thank you for the great presentation. And I see all the questions in the chat. Just before we get to the questions, big overview for those that don't know, the discussion started out because we were hearing how do we ensure during COVID, this when I was a state representative before being the director of the Board of Nursing, we were hearing when we were working on nursing workforce, but how do students become more comfortable, have the ability to be around patients, not just in their clinicals, outside of their clinicals, have compensation for it for those that are looking for work, as well as hospitals having another way or any setting have a way for workforce retention. And so I'm loving what I'm hearing about nursing student, nurse intern, graduate, nurse residency, and nurse, because when we look at the big picture of retention versus turnover that can happen in a year, we know that that is a contributing factor. And then we were able to remove some of the barriers that we heard that existed from the first iteration of rules post law passing. So thank you, Sky Lakes, for being a leader and getting this up and running despite the barriers, and now continuing to be a leader with those barriers removed. And thank you, Laura, for your work on pulling together Rule Advisory Committee to remove some of those barriers. Jumping into the questions, so I'm going to go from top to bottom, and I know, Karen, you're asking about other facilities in Portland metro area that have a nurse intern program. I can't answer 100% yes or no, but I know there's huge interest because they've reached out to myself or Laura Blackhurst. Laura, do you know any that have officially 100% started one yet?
I don't know of any that have officially started one, but like you said, there are a lot of hospital systems in the Portland area that are very interested in the role.
Yeah, thank you. And then do these nurse interns receive compensation? And I know, Cynthia, that you spoke to that. And what is the rate? I know this was a discussion for a while of what is the difference between a CNA and a nurse intern and the different rates, but of course, a nurse intern is a nursing student. I'm not 100% on rates, but I don't know, and I don't know if Sky Lakes wants to share specifically what their rates are, but that question probably was towards you, but I'm sure you can also Google nurse intern, Oregon, and you'll find a job posting at the few hospitals that are already posting them. Anybody want to add anything, Laura, Cynthia, or you feel good with that?
Feel good with that.
Okay, good. And I will say this was a big discussion during the legislature of it is paid, but we had a very difficult time having in statute that schools would be able to also give credit because it was a very challenging, complicated process. So that is separate. And how many interns have you hired? I'd say that goes to you, Cynthia and Jessica.
We currently have 11, and we have 8 more job postings out to hire 8 more. We have
Great.
8 graduating here shortly, so we need to replace the ones that will be moving to their nursing career.
That's exciting. And I know Oregon State Board of Nursing on our website at any given time has the numbers of how many nurse interns are working across the state. And it's the most it's ever been. It's still too low though. So I'm excited to have this lunch and learn for everybody to learn about it. So the CNA is orienting beyond simple workflow and environment, and an RN is performing any competency checkoffs. I'm a little confused about that question. I don't know if Tammy, you want to come off mute and explain it a little more, and maybe Sky Lakes can answer.
Sorry about that. I was looking for my mute button.
No problem. I wanted to give you time.
So after having listened to several other lunch and learns and looking at the Board of Nursing and the CNA authorized duties and that sort of thing, CNAs aren't supposed to be training. They aren't supposed to be validating competency, according to what I understand, that they're pretty specific to orienting to workflow and how the unit flows and the environment. So are your CNAs going beyond that? Or do I have too narrow of a vision of what CNAs are capable of doing when it comes to educating?
is that after we have validated all of their skills, we keep them in training and development for a couple of weeks and we go through them. They are just working beside the CNA. We are not asking the CNA to provide oversight, nor are we asking them to evaluate their performance, but we want them to do those tasks. Of course, all CNA
Absolutely.
tasks are really nursing tasks.
Of
And we
course.
feel like it provides them with a really great foundation. In
Mhm.
school, a lot of them are not some of those basic skills. And so in order to work in our facility, we felt strongly that they needed a couple of weeks in that role.
That answered my question very well. Thank you.
You're welcome.
Thanks, Tammy, and thanks, Cynthia and Jessica. So I think when maybe Jessica was saying it's like the middleman between the CNA and nurse, but I think
Mhm.
you were more meaning it's a team
It's a team.
Yeah, it's just-
of okay, great. I'm glad we got that clarification. Thanks for asking that. So from Sue Kim, teaching students new to the nursing arena, the basics of nursing is so important. So they have strong foundations for practice. Kudos. So much more of a comment. Thanks. From Chloe, are the interns included in your nurse staffing plan when they are working? That is a interesting question. I'm sure you can probably take that, Sky Lakes.
Yes, they are not. They are really a bonus when they are on the units. And in all honesty, I really, because we do not staff them every day, we are staffing them according to the needs of of the nursing student or the nurse intern. So it would be pretty tough to say that every unit had to have a nurse intern as far as part of their staffing, which is maybe even contributed more to why our staff is so excited when they get a nurse intern.
Yeah, I think, oh, sorry, Jessica, I didn't mean to cut you off. Go ahead.
It's okay. I was just wanting to speak to, we really want them to feel supported in their schooling. And so making sure that they are able to provide the days that they can work around their class time or IP, making sure that they're not feeling like they're having to be pulled one way or the other, that we can make both work.
Yeah, but I do, Chloe, I think that's a great question because this is one of the reasons I think was also there were barriers to some of the rules, but there was also this concern because it kind of came into play around the same time, and nurse managers were trying to really figure out the staffing law. So thank you for answering that and asking. And then someone was just the last one. Can I see the slide again about check-ins and weekly, bi-weekly? Christy was asking for that. I don't know if you want to go back to that slide, but just for everybody to know, this is going to be posted on our YouTube page, so you will be able to go back to the slide. But if Laura or Nicole, whoever is in charge of the slideshow, seems Sky Lakes may have had one.
Yeah, I apologize. I'm not quite sure which slide. I
I
don't
think
know.
this is it. Is this one it, Christy, or okay, great. Well, I made it through all the questions and comments in the chat, but we'll have a few minutes of uncomfortable silence to see if anybody wants to, not uncomfortable, comfortable silence, to see if anybody wants to throw in another question or come off mute and ask a question. Anything else you're thinking about, Laura, for closing thoughts while we're giving them last chance for questions?
I think what I will do is I'll put up our contact information.
Yes.
So that after this presentation, like Director Prusak said, you'll be able to watch it again on our OSBN YouTube page. But if you have questions, you can always reach out directly to me, Director Prusak. We also have a general Board of Nursing email address you can reach out to. But, and then I do see a question about a link to the YouTube page. Yes, I think we can find that. Actually, I'm going to ask Nicole, could you find that and put that in the chat?
It is on our webpage under meetings, but we can definitely put it in the chat. Thanks, Barb.
Perfect. Thank you. All right, I guess if there are no other questions, thank you so much, everyone, for your time and interest today. And again, thank you so much to Cindy and Jessica for their time today. It was so valuable, not just to hear about the administrative rules, but to really see how this role has been implemented in a different system. So thank you all.
Thank you.